welcome to Interactive Podcasting. Today we will look at the examination of the thyroid gland. The aims and objectives of today's lecture are to review the examination of the thyroid gland, to learn the signs of thyroid disease which patients clinically present with. We will review the thyroid eye signs and how to elicit them, and finally we will discuss the differential diagnoses in neck swellings.
Hello sir, my name is John Land, I'm one of the doctors here. Can I have a look at your neck, is that okay?
Yeah, alright.
Can I have a look at your other hand? Can you hold your hands out in front of you there? That's very good. Okay, just pop your hands down to your side. Okay. If you'd like to take a mouthful of water and just hold it in your mouth. And swallow, please. That's very good. And if you could open your mouth now and stick your tongue out. That's very good. Pop it away. Just have a look. Just follow my finger with your eyes. That's fine. Is it sore anywhere in the neck, sir?
No.
I'm just going to gently feel it. Okay, we'd like to take another mouthful of water. Just hold it there. And swallow, please. Okay, that's fine. Pushing the neck a little bit. Okay. Just hold your breath just for a second. Okay, that's fine. Breathe normally. And could you just turn around so that you kneel on the chair for me, sir?
This is the word bit.
Yes.
I've got problems with my knees and here.
Sorry, we'll just be a second. Just going to tap on you. Okay, that's very good, thank you. That's great. Thank you very much indeed for helping.
The examiner introduces himself to the patient, obtains the patient's consent to the examination, and shakes the patient's hand. Does the palm feel hot and sweaty, hypothyroid disease, or perhaps dry with coarse skin and puffiness? The examiner listens to the patient's voice. Is it normal or low-pitched? A low-pitched voice can occur in the hypothyroid patient. Is there any suggestion of confusion or memory impairment, which can be a feature of hypothyroidism? The examiner feels the patient's pulse. Is it slow, bradycardia, which can occur in hypothyroid disease? Is it rapid, which can occur in hyperthyroidism? Is the patient in atrial fibrillation, which can also be a feature of the hyperthyroid patient? The examiner looks at the palms and checks for tremor. The examiner steps back and observes the general appearance of the patient. Is there any eye signs suggestive of Graves' disease? Does the patient's eyes look puffy or is there any peripheral edema, hypothyroidism? The examiner carefully inspects the neck from the front. The neck must be fully exposed. It's preferable to use tangential light. Ask the patient to tip their head back. Look below the cricoid cartilage. Can you see any obvious swelling? Next, ask the patient to swallow, passing them a glass of water. Does the swelling move? A thyroid swelling moves upwards on swallowing. Ask the patient to stick their tongue out. A thyroglossal cyst moves when the patient sticks their tongue out. Next, the examiner checks for signs of lid retraction and lid lag. Is any of the white of the eye visible just below the upper eyelid? The examiner asks the patient to follow his finger with his eyes. Is there any lid lag? Next, the examiner moves and positions himself behind the patient. He looks down the plane of the forehead from above. Is there any exophthalmos? He asks the patient if the gland is sore anywhere before palpating the gland. It's helpful to ask the patient to flex the neck slightly. Place both your hands on the patient's neck so your index fingers are below the cricoid cartilage and nearly touching. Ask the patient to swallow. You must make sure they have a glass of water. Feel the isthmus and lobes. Again, does the swelling move upwards when they swallow? Think about what you feel and try to describe it. Is it one lobe or both that you feel? Are they diffusely enlarged? Is there a single nodule or multiple nodules? Next, the examiner checks for lymph glands. Beginning below the jaw, he feels for submental and submandibular glands, then cervical glands, and finally supraclavicular glands. He also feels for postauricular and occipital glands. Some examiners prefer to feel for these from the front. A large thyroid gland may extend retrosternally below the manubrium. The examiner percusses over the manubrium to see if there's any retrosternal extension of the goiter. The examiner uses the stethoscope to auscultate the gland. Is there a bruit audible? Finally, if you suspect the patient might be hypothyroid, check the reflexes. The ankle reflex may have a delayed relaxation in hypothyroid patients.
Thank you for downloading this presentation by Interactive Podcasting. If you want to see more presentations or subscribe to our iTunes link, then please follow the web address displayed on the screen below.